Welcome back to the Shine Within podcast. Dr. Diana Drake is a board certified traditional naturopath specializing in skin hormone and thyroid health through a holistic and science backed approach. With over 2 decades of experience, she is the founder of Dr. Dale Wellness and Skin Naturopathics, where she develops natural internal supplements to address inflammatory skin conditions like acne, eczema, and rosacea. Through advanced transdermal screening and comprehensive blood testing, Dr. Drake crafts personalized treatment plans that focus on the root causes of health issues rather than just symptoms. As a sought after mentor and educator, she empowers both clients and wellness practitioners with the knowledge and tools to achieve sustainable healing. Passionate about bridging alternative medicine and science, Dr. Drake is redefining the future of holistic wellness. Well, thank you so much for being on my show, Dr. Diana. It's so nice to meet you.
Yes, thank you, you too. And everything you pronounce perfectly beautifully. I know that's a mouthful.
Oh, I love it because this is, I'm learning too. And this is why I love bringing on experts like yourself, is because I want to learn. Not only does my audience want to learn, but I want to learn. And so I always say podcasts are wonderful because not only do I meet beautiful human beings, but I'm learning in the process and I'm spreading the message out there to the world.
Absolutely.
Or we are spreading the message out
Yes,
there to
we
the
are.
world.
Yes, very important.
Yes. So, Dr. Dana, your work is pretty much redefining the way we approach skin, hormone, and thyroid health. What actually first drew you to what you're doing right now,
All of
and
the
how
things.
did you, how to say you're doing so much, and how did
Yeah.
your journey lead you to create your own wellness business and brands?
Yes, absolutely. So kind of a sad story, but when I was 23, my mother passed away. She had her second heart attack. She was in great shape and she was taking a statin drug at the time, which I was also taking because when I was very young, I was also diagnosed with, cholesterol that was too high. So here we are both taking these drugs, thinking that this is going to, prevent us from cardiovascular disease. And then she passed away. So that was kind of when I first woke up to realizing that there's kind of something wrong with Western medicine. Now, don't get me wrong. Obviously, if I were in a car accident or if I have a heart attack or if I break a bone, we need Western medicine. But I'm really a proponent that Western medicine is for acute things and emergencies, but any sort of chronic disease really is best treated with natural medicine just because it works with the body to rebalance everything. And, the body heals from the inside out. So we have to work on that root cause and then the symptom is eliminated. That's the opposite of Western medicine. Western medicine says, let's just eliminate the symptom with a drug, but the root cause continues to go unchecked, right? So, especially when we're dealing with something like, let's say, acne, for example, anyone knows if you have a teenager that you've taken to the dermatologist or to an MD with acne, they just want to give you a drug or they want to give you an antibiotic. Um, I'm having brain fog. What's the drug? Accutane they want to give you for acne, right? But now we know that this causes all kinds of problems later if you're taking Accutane, or if you take antibiotics, as soon as you're done with the antibiotic, the acne comes back. So we're not really healing anything, right? We're just putting a band-aid on something, stopping it for a while, but the root cause is still running rampant in your body. So it's really best to understand what the root causes are and just understand that you can always take a drug. We always have drugs as a backup and a last resort. I would just love people to think of it as that. Like, if I need a drug, if I've tried everything else, okay, I can take a drug, but let's try to work with the body first and help it do what it's trying to do and figure out what's going wrong before we, resort to taking a drug.
I hear you. I remember when I fell down. Oh my goodness, I had my son in my arms. He was like maybe 1 years old. And I slipped and fell and I busted my knee. Yes,
Ooh.
those drugs they gave me morphine was important at that time, but I am one of those people who don't like taking medication. I used to be on so many medications early on in my
Mm.
sobriety, but
Mhm.
they weren't doing anything for me. I think my anxiety was worse. I believe like I wasn't sleeping properly and I felt like I was going backwards. I'm like, I'm supposed to be getting better. And it wasn't until
Mhm.
I started, getting off those medicines, and of course, becoming sober, and really just started taking supplements. That really helped me. And I know you actually developed a line of internal supplements for, skin conditions. Like we are talking about eczema, acne. I used to
Mhm.
have adult acne too, and rosacea.
Yes.
Can you
Yes.
actually go ahead and share how these natural solutions work from the inside out?
Yeah, absolutely. So when we're dealing with acne, a lot of people don't realize, well, they realize that there's a hormonal component, right? Like women will say, I have hormonal acne. Well, an antibiotic isn't really what we would use to balance hormones, right?
Right.
So it is important to heal the gut and to work on, any sort of bacterial issue. But really, a lot of hormonal acne is coming from excess or elevated androgens, which is also an indicator of PCOS, which is in most women and it's not properly diagnosed. So, if you're young and you have acne, if your periods are bad, maybe you're missing periods, this is really a sign that something's going on with your endocrine system that needs to be addressed. That's not going to be addressed properly if you take Accutane or, antibiotics. So it's really important that number one, we identify what is off. Is it the microbiome? So I do testing for gut permeability so I can tell you if your gut is leaking or not. I also do food sensitivity testing. So we know, are we reacting to foods? Is the gut leaking? Then we look at hormones, and I don't do a test with blood. I do a really in-depth saliva test. So I'm looking at all of your hormones, your melatonin. I'm looking at your cortisol function throughout the entire day. So I get a whole map of what's going on throughout the entire day. And only when I see that whole picture can I really decide, okay, this is what's going on. This is the root cause. So the Line Skin Naturopathics deals with healing the gut, balancing the hormones, detoxification. So it's a really nice, easy to customize line that has different protocols for each type of skin condition. And that really started, I actually used to be an esthetician. So I developed that brand in relationship to that and becoming a naturopath. And then what happened was as I became a naturopath, I had all these people that really needed help with other hormone issues. And then it went into thyroid issues. So the whole bucket of what I work on, there is some sort of an endocrine relationship. So some sort of a hormonal relationship. And then it's like, I go into menopause and all these different things. So really anything hormones and related to hormones I work on. And then of course, there's always going to be stuff off with the body. Like when you were saying anxiety, anxiety, depression, anybody that's on medication for depression, a lot of that is actually stuff going on with the gut because over 90% of our neurotransmitters are actually made in our gut, not our brain. So one of the big steps to healing depression and anxiety is actually working on the gut and getting proper neurotransmitter production instead of just taking the drugs that's forcing the brain to do it.
Right. Yes. And I'm 43 years old and I'm experiencing some hormonal imbalances for sure right now. And, there's a lot of women with issues like PCOS, they have like thyroid disorders and even
Mhm.
infertility problems. And it's
Yes.
affecting so many women. What do you think is driving the rise? And how can we actually
Oh,
start beginning to rebalance naturally?
yes. Well, the two main answers are toxicity and diet. So, as women, and you know this, we are more carb driven diet people, right? Like we crave sugar, we want chocolate, more breads. Men, they really crave more of like the meats, right? That's just not really women. So, when we're young and we're growing up in America, having a dessert every night, eating candy, Halloween, birthday parties, it's too much carbs and sugar. And that actually creates something called insulin resistance. And this is happening in men too, because guys get too much sugar when they're young too. And that really causes an increase in androgens. And that increase in androgens causes the acne, the periods get all wonky. It can cause cysts, all kinds of things. So, really, a diet that is clear of sugar and processed grains is a key here. Also, seed oils. If there's any mothers listening to this, I know I get pushback all the time, like, oh, that's the only thing my kid will eat, and I can't control what they eat. But you have to take responsibility. If you don't correct your child's eating habits, you are giving them insulin resistant, and it's going to lead to some sort of metabolic dysfunction. If you have a male, it's going to lead to issues with his skin, with his blood sugar. If you have a female, it's going to lead to infertility, period issues, issues with her skin, all kinds of issues that we can better control with diet, right? So there's the diet piece, and then the toxicity. We can't even control the things that we're getting in our, even if you drink purified water and you have purified water filters on your whole home, you're still breathing the air, you're still eating, even organic food is still sprayed with pesticides and it's getting watered with water that's not cleaned first. Like it's just city water. So we just have too much toxic overburden, and those little toxins, they just plug into our hormone receptor sites and take up space where hormone is supposed to be doing its function. So a lot of things really can be corrected with diet and detoxification.
And that's the path I'm on right now because I was
Yes,
the carbohydrate eater and I'm like, what am
me
I
too.
doing? I don't really I had stopped for a while, but
Yeah,
then I started up again and then it was like addicting. I'm like, why
it
am I
is.
craving carbs? And so right now, I know, I was just thinking about the organic food. I'm glad you brought that up because I had that question like, is it really organic? Like, are they still spraying stuff? Like, I don't know what you feel about the chemtrails. I always call them chemical trails, and it's just like
Yes.
ruining our
Huge problem.
atmosphere.
Huge problem. Exactly my point. You could be eating perfect, drinking the perfect water, you're still going to get poisoned. So the good news is, since it literally is impossible to eat perfect, to be completely detoxed all the time, this is where supplementation can come in and pick up the slack, right? So it's really important that every human being detoxes every spring and every fall. So in the Dr. Dale line, we have a really great full body detox that you can buy as a kit. On Skin Naturopathics, I have a derma detox. It's a whole body detox with an emphasis on cleaning out the skin and lymphatics. So that's great. We also have parasite detoxification. That's a huge deal. So just bringing into the culture that we need to detox every spring and fall is great because other cultures, it's part of their culture. In India, in Japan, in China, they all know to detox every spring and fall. That's built in for them. Here, people are like, what do you mean detox? Like, no, I've never done that. So we need to make that like part of our normal routines every year. And I do it more than twice a year. I do every quarter I do a detox just because I know all the toxins that I'm getting exposed to. So
Yeah.
yeah, lots of detoxification available in both lines. We have homeopathy as well. And if you're hearing this and you're like, okay, this sounds good, but I don't know what to do. I offer a free 15-minute phone consultation to anyone that wants to work with me that you can easily book at dmdnaturalmedicine.com. So you can just click and get a consultation and just kind of tell me what's going on. And I'll say, okay, I recommend we do this test. And then if you move forward with the full consultation, we'll review your labs, we'll review your diet, your lifestyle, all the history, and get you on a path moving forward, hopefully out of whatever is ailing you.
Yeah. Can you go ahead and share a success story of someone who's transformed their health through your approach?
Oh my gosh, only one? Okay.
Or
There's
more.
okay. So one of the biggest things that people come to me for, probably 50% of my practice is thyroid. So it's really unfortunate that, doctors are telling people your only option is a drug because it's not true. The longer you're on a thyroid drug, the harder it is to get off, but it can be done. So I have a lot of people coming to me and they say, "Can you take me off this drug?" So that's my biggest success as a whole is getting people off the thyroid drug, getting your TSH in balance, using natural supplements, and just getting the thyroid rehabilitated. It's a very long journey. It's not going to happen in 6 months. Sometimes it takes 2 years, especially, I have people that have been on a drug for 20 years. That takes at least 2 years to fix, right? So just remember the longer you've been on a drug, the longer it's going to take to rebalance, but it is possible to get off drugs. I've had people literally cry to me of how terrible they feel on HRT, on a thyroid drug, on head medication, and just turning their lives around. And then they cry to me about how much better they feel and how thankful they are. That's always very moving to me. Obviously, not all cases are that extreme, but also skin conditions, like sometimes if you have really bad eczema or psoriasis or acne, like it's embarrassing. You don't want to, you're trying to be a professional or you're like a young woman trying to get a husband. It's not fun to have your face and your body all messed up. So it's really nice to see, every week, every month when we're meeting, how the stuff's slowly clearing up and people's self-esteem is coming back and they just feel better and they understand better. Okay, if I make this choice to do this and this and this, I know the consequences, this and this and this. So it really creates more awareness and more accountability of what we're doing, how we're treating our bodies, and just knowing what affects us. Because they don't really teach us these things in school. Like we take a biology class and they teach you what the organs do, but nobody really teaches us like how to use our body and what's going on in there. And I think that's a huge detriment to society as well. But they purposely do that. They don't want us to know. They want us to just go to the doctor and listen to the doctor.
Yes, it's true. It's a disease management system instead of a healthcare system, I feel. They just want
Exactly.
to keep us ill so that way they can make money off us. It's not fair. They want
It
us
really
dead.
is. It really
But
is not fair.
that's why
And
we need to see
there's,
people like you so we can live
yeah,
longer and live joyful and with
that's right.
have a vibrant life.
Exactly. I
Because that's
know.
our birthright. We're not
Yeah,
supposed to be
it is.
sick. We're not
Yes.
supposed to be
And it's
ill.
sad because I mean, it is a system. The medical system is a for-profit business. And that doesn't mean that the doctors and the nurses working within it are bad.
Right.
A lot of people, when they call me, oh my God, my doctor, I can't stand this and this, like what an idiot. And I'm like, they're not idiots. They're very well educated to do something specific. And that thing is their job is to diagnose disease and to give you drugs or surgery. That's it. It's not their job to tell you how to eat, unfortunately. It's not their job to tell you how to detox. They didn't learn any of that stuff. So we can't expect that from them. But it's just unfortunate because we're told, oh, you have to have insurance. And if you don't have insurance, going naturally and working with me, it's not cheap to do. Even a lot of times, like I do work with people on price, but I've had some people that are just like on Social Security and have no money. And even if I charge nothing for my fee, they can't afford the supplements. I mean, some of this stuff, it does get expensive. So it's hard to put your money into insurance and that system and then also into wellness. But that's how they keep you in that system as well. Cause they're like, oh, you don't have to use our system, but you're not going to get covered by insurance. Good luck.
It's messed up, right? So that's why people think, oh, wellness is so expensive. It really isn't. Illness is very
Oh, this
expensive.
is expensive. Yes, exactly.
Yes.
Yeah.
Now
I don't
oh, go
Go
ahead.
ahead. No, well, I was just gonna say I mean, I don't really carry insurance. Like for me, I'd rather spend the $500 a month on all the supplements that I take. And obviously, if I ever have an emergency, I will just have to work out a payment plan. But that's that's just my own. I just don't want to buy into that system.
Right.
It's just kind of my own personal line in the sand. But
I
not that I'm
agree.
not for anyone. That's just my personal choice. But I just am not involved in that system at all.
Yes, same. Well, my husband has insurance just in case, but I don't even know when the last time I went to the doctor. Because I've been well. Because I take
Yeah.
care of myself, so
Yeah.
I've been well.
Yeah, absolutely.
Yeah.
And, also, when I'm working with someone, if they have a doctor that's cool and I say, hey, we need these labs, go get them through your doctor so you can use your insurance, that's totally fine. Obviously, some of the specialty labs, like if we do a saliva hormone panel, that's something that doctors don't do. Like they can kind of only do blood labs. So some of the specialty labs, they range about a couple $100s, but it's so much great information that you just will never get from a regular medical doctor appointment. You just won't.
Right. Now it's so often there's, skepticism around alternative medicine. How do you
Mm-hmm.
actually bridge the gap between science and holistic healing in your work?
Yeah. So because I am virtual, I rely so heavily on lab work. So I'm not just saying, oh, I think you have this. Like there's a lot of people working in like the medical medium space where they like tell you that they think you have this and this and this. That to me is not scientific. So I'm really going off of like, what does your lab work say? Then I show you, okay, this could be related to this symptom that you're saying, or this makes sense because of this. So everything really is lab driven. And then I just have because I am specialized, I just have so much experience with certain things that I've seen that it works, right? So that's just really relying on labs and making sure that everything matches up, follow-up labs, people feeling better. So everything is really tracked and well looked at, I would say.
Yeah, what are some of those
Lots of
daily
hands.
habits? Oh, I know it's a great answer. Labs are important. You know what? You reminded me I need to get my lab work done. That's something
Yes.
that I need to prioritize because I haven't had lab work done in about a couple of years, I think. How often
Yes.
do you think we should be getting lab work done?
Well, that's a really great question because it depends on the lab. Like if you just go get a regular CBC panel, you're going to get cholesterol, blood sugar, some important biomarkers on there, but a lot of times they miss stuff on there and they're not robust enough. So I would work with someone to get you labs based on what you're experiencing. So if you say you're well, you feel good, I would probably, if you say but see, you did say that you maybe think you have some hormone things going on. So I would definitely test you for hormones. Then important things to look at are inflammation, so C-reactive protein and homocysteine levels, looking at cholesterol, triglycerides, good cholesterol, bad cholesterol, definitely A1C, glucose, and insulin. You want all three levels on there. And then a lot of the other stuff that they run usually isn't that valuable unless you like have an infection or something. But looking at vitamin D levels is great as well. But really, what I do is based on, because when people come to me, something is wrong, right? Like when they're hiring me, something is wrong. I do get some people that are just like, I just want to make sure that I'm okay. And that's fine. I'll run kind of general things on them as well. But even the people that are like, everything's fine, when they look at all the symptom questionnaires I give, they start realizing, okay, maybe this, maybe that, so those are all indicators of how I can test them better, because it's like a one size fits all thing. When the the doctors are just running a general blood panel on everybody, there's like so much stuff that they're missing. I think they could be more detailed.
Makes
And people
sense.
don't know what to ask
That's
for.
true.
People don't know to be like, oh, will you also test my C-reactive protein and homocysteine? Like people don't know that. But there's no drug for inflammation in your body. So why would they run a test for C-reactive protein and homocysteine if there's not a drug for that? So for example, the cholesterol piece, going back to my mom, if your cholesterol is in range, but it's inflamed and you have oxidation of the cholesterol, you can still have a cardiovascular event, which is probably what happened in her case. On the other side, let's say your cholesterol is a little higher, but your inflammation is low, you're still safe if your triglycerides and your good cholesterol is where we want it to be and the bad cholesterol. So you really have to look at all these ratios very particularly. And that's not something that they're doing well in Western medicine right now. And heart disease, it doesn't get as much attention as like breast cancer, for example, but heart disease is the #1 killer in America. So it's really important to be looking at ratios of cholesterol and inflammation in the body.
Yeah, so we know that supplements are very good to take, but healing is also about lifestyle choices.
Yeah.
What are some daily habits you actually would recommend to maintain like balanced hormones for myself and like healthy skin? Because people always talk
Okay.
about skin all the time.
Okay, the best thing you can do for your skin, you guys, is lots of antioxidants. Okay, so vitamin C, CoQ10, resveratrol, glutathione, N-acetylcysteine, all of those, grape seed extract, as many antioxidants as you can get, the better, because that's going to help neutralize free radical damage in your body, which is what causes aging. So that's great for people who like want to look younger. Also, generally speaking, I think the rebounders are great. I have one in the back. You can't see it, but just those little mini trampolines. If you can just jump on that for 5 minutes a day, it really moves your lymphatic, which is really good for breast tissue. It kind of gets everything going. It's different than walking on a treadmill because you're getting the bounce. That's a really healthy, inexpensive thing that you can do every day. That's great for detoxification. And then diet-wise, same rules apply to everybody. No sugar, no caffeine, no processed grains. So that's gluten, bread, corn, bagels, pizza, cake, all the fun stuff. None of that. And then get rid of seed oils. So all my menopausal women that start to gain weight when you get towards menopause, and once your hormones are turning too low, like you start to gain weight like crazy. Really getting as close as you can to that higher healthy fat keto diet is going to help reset insulin resistance and help with hormones. So that's a good
Beautiful.
one too. Yeah. So kind of like not all the way in ketosis, and that's not carnivore. It's just like higher fat and fiber. That really helps with resetting hormones, insulin, weight loss, all that kind of stuff.
Wow. Now, you not only treat clients, but you also mentor and train wellness practitioners.
Yes, I do.
Yeah. What do you love most about empowering others in the
Yes.
natural healing space?
Well, I love it because when you're a practitioner, I can only work with one person at a time as me, right? But if I can train more practitioners that are each touching 100 people a month or whatever it is, we can heal more people. So with the Dr. Dale line, for example, we have homeopathic hormone rejuvenation. So we have topical hormone gels that are hormone free. They just have homeopathic frequency of hormones. So when you give the body the frequency of a hormone, it's kind of like giving the cell a little bit of a blueprint, kind of telling it like, hey, we want you to do this. We want to correct what's going on and balance what you're doing. So we can get native production of hormones going again. Obviously, the protocols are different if you're young versus when you're in menopause, but I teach practitioners how to use these products correctly, how to run it on a cycling woman versus someone in menopause. Now, obviously, we're not going to get your hormones up like we would if you're taking HRT, and your testosterone's not going to be what it is like when you were 20, which you can do with HRT synthetically, right? We're not doing that, but we're just getting you into natural range for your age, because even in menopause, we're supposed to still have some hormone production from the adrenals once our ovaries shut down. But our adrenals are so exhausted from the coffee and the stress of life and the toxins that they can't do anything.
Makes
So
sense.
menopause is not supposed to be so hard on us like it's become. So really helping people go through that transition easier with homeopathy is great. And then just training my practitioners to help because as we age, so does our client base. So we need to be able to help them through that transition. And I don't know if you know this, but for the most part, our wellness practitioners mostly we're treating women. Women just have more issues because of our hormones, because of the thyroid piece, because of the breast cancer stuff. So most of my practice is women. I just get men a lot less. They just have less issues, or they're just less open to, natural medicine. I don't know. But so I'm training a lot of the practitioners on balancing all of the endocrine system for guys and women. I just would love it if we had more guys, is my point.
I know my husband's just barely taking supplements. He stopped.
Yeah.
Actually, he never took anything.
Yeah.
And then he's had this prolonged cough forever and it just wouldn't go away. But he's moving fine, he's feeling fine. He's just and then he's like, "You know what? I'm going to start taking supplements." I'm like, "Oh my goodness, the world is changing."
Yes.
So he just started yesterday, and so I'm so excited for him. Like, wow, finally, but we'll see
That's
what
awesome.
happens. Yeah, so men need to start speaking up. I don't know if they're just have a lot of pride or I don't I
Yes.
don't
You know
know.
what is so funny though, Gina, about when I do get a male client, they are so good. Like they do exactly what I tell them.
Oh
They
wow.
never miss their appointments. I say what to, they're like, okay, yep, 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 got it, do it. They have the least amount of questions. It's so funny. They're almost like easier to do. Like they follow instructions better. It's so interesting. Women, it's harder for us to make all these changes because we have more cravings and things, I feel like. So it's
Makes
harder
sense.
to, and eat myself too. Like I'm not gonna not eat pizza ever again. Okay. I like to go have treats once in a while.
Yeah.
And I do like at home, I eat really clean. I don't have any sugar here. I don't have any carbs here. I don't have any seed oils here. When I go to restaurants, I'm a little more loose, but then I take supplementation to fill in the gaps.
Mm.
But it's just interesting when I do get men, and it's usually for skin conditions, they'll come in, they just are so compliant and
Wow.
so good. They will listen to eat exactly what I tell them, and they clear up a lot faster too. It's interesting.
Because you're following your instructions.
Yes.
Where women
Yes.
are like, I don't know, wishy-washy.
Yes, exactly.
Hey, I'm like that too sometimes, but I've gotten a lot better.
Yeah.
No, last question now with the rise of holistic and functional medicine, where do you actually see the future of healthcare going?
Well, I would love to say that someday they would let people, such as myself, take insurance. I don't know. That's probably a pipe dream. But here's what I would really like to see that I think is more feasible. I would like to see doctors that are more open and willing to, if a patient says, "Hey, I'm working with so and so on getting low on my thyroid medication, like getting off my thyroid medication," I would like doctors to say, "Okay, let's monitor what you're doing healthily, like, responsibly as you're doing this with your practitioner so that we can make sure you're safe during the transition time instead of, oh no, I don't, you're not, I'm not going to do that. That's dangerous. I'm not doing that." Because what happens is that client of mine, it just goes and gets a new doctor, right? Because they are on a mission. They want to get off the drug. So it would be nice if doctors were just a little bit more on board with us. It doesn't mean that they have to take extra time to talk to me about their patient. All it means is if we're asking to lower on a drug and to monitor on blood labs using their insurance, let's just play ball with each other so we can get the patient where they need to be. It needs to be about the patient and what they want and where they need to be, not about what the doctor wants or what I want or about, what the insurance wants, because insurance companies, they put quotas on doctors. They
Mm.
say, if you're going to keep taking our insurance, you need to be doing this many mammograms a year. You need to be doing these types of labs. They need to come in for a certain amount of visits. Those visits cannot exceed 15 minutes. That's
Mm.
obscene. You
Wow.
can't get anything done in 15 minutes,
Right.
especially when you're dealing with a disease. It's just like, because it's just designed to be like, what's wrong? Here's a script. See you later. See you in 3 months or whatever it is. So it would just be nice if they don't have to know anything about natural medicine. We're not asking them to learn more or to do something outside of their license. Just like if a patient says they want to do something, just play ball a little bit better.
Wow, absolutely. Yes. Now, I know you mentioned this earlier in the podcast, but can you go ahead and just share with our listeners how they can connect with you and learn
Yeah.
more about your work and explore your products and services?
Yes, absolutely. So if anyone wants to work with me as a practitioner, you can visit my practitioner website, which is DMD. It stands for Diana Marie Drake, dmdnaturalmedicine.com. Upper left-hand link will get you a free consultation. You can also shop labs and supplements from that page as well. Or you can go directly to skinnaturopathics.com for the skincare line and to drdalewellness.com. So DRDALE wellness.com for all the hormone and Dr. Dale stuff.
Beautiful. And I will have everything in the show notes for our
Okay.
listeners. And yes, Dr. Diana, anything else you would like to share?
I don't think so. I just really want everyone to know that no matter what you're going through, talk to a wellness professional, okay? Just get another opinion, especially if you're being told that you need to take a drug. Before you agree to the drug, just talk to a wellness professional because once you get on HRT, thyroid medication, and you stop, that stops production of your own natural hormones because you're putting into the body altogether. So it's a lot harder to get you back from there. It's a lot easier to balance the body if you don't take the drug, right? So try to get to that spot where if you're being told you need it, talk to someone else first, and then you can decide, okay, these are my options. But it's way easier to do that than to try to get you off the drug later. So that's my big takeaway for everybody, I think.
Yes, yes, and yes. Well, thank you so much
Mhm.
for being on my show today. I feel like I've
Oh,
learned so much
so,
just chatting with
oh, so
you.
glad. Okay, good. All
Thank
right, I
you.
like to talk a lot.
I love it. Thank you so much.
You're welcome.